Thank you, committee. My name is Cole Allen with the Oklahoma Policy Institute. I'm our criminal justice analyst. I'd like to thank Representative Lowe and Chairman Hardin for having this study today, and Chairman Humphrey whenever he gets here. But mental health in our jails and our criminal justice system at large is a very important issue, one that Oklahoma has been working on for the past several years. We've done a lot of good, but we have a long way to go. And so today I'm going to talk about mental health treatment and diversion services as being our first line of defense, the best option, the best policy for preventing and treating mental health in jails by ensuring that we reduce the burden on our jails in the first place. Then I'll talk about improving the training, quality, and availability of mental health treatment in jails, specifically our standards at the state level for jail staff. And then I'll finish by talking about our pretrial release process and how that impacts mental health in jails, especially for individuals who are staying in jails for an extended period of time. Jails should not be our default or first response for mental health treatment in Oklahoma. Unfortunately, in Oklahoma and the rest of the nation, jails have historically been where people with untreated or even treated mental illness end up. The largest mental health facility in the country is the LA County jail system, not a hospital, not a treatment facility, a jail. So this is not just an Oklahoma problem, but it is a problem in Oklahoma. And a big part of that is because historically, and even today, Oklahomans struggle to get access to mental health treatment. The Mental Health America rankings out of 2024 rank Oklahoma number 47 in adult mental health. A big contributing factor to this is the fact that 1 in 5 adults in Oklahoma has had a substance use disorder in the past year. We're number 39 in youth mental health, where over half of youth who experienced a major depressive episode were unable to get treatment that they needed. And we're 39 in access to care overall, partly because 1 in 3 adults who experience frequent mental distress could not afford care. We have a problem of accessibility to care in our state. It stems in part from a workforce shortage, which is a problem nationally, but also affordability of care. We've done things like expand Medicaid, which has helped this problem significantly, but there are still lapses that affect people. Co-pays are unaffordable, emergency health care is even less affordable, and so people go without treatment for their mental health issues, which can cause massive public safety issues and affects our tax base. When left untreated, mental illnesses can result in behaviors that lead to law enforcement intervention. I want to be clear that this is not necessarily crime. In fact, people with mental illnesses are more likely to be victims of crime than perpetrators. Regardless, this leads to situations where law enforcement officers have to be present at a scene. If people are in crisis and their loved ones or neighbors or strangers don't know who to call, they often call the police. Or if someone is victimized or maybe even commits a crime, police are involved and they're not given the training that they need to adequately de-escalate and help people seek treatment. If we provide mental health treatment more broadly, we can reduce the risk or severity of future health crises, the burden on our first responders, hospitals, and jails, and the tax burden, dollars that we spend on jail, and covering uncompensated emergency care that results from these crises. As a state, we have done a lot to expand prevention and treatment options. Like I mentioned, Medicaid, but also opening statewide CCBHCs, Certified Community Behavioral Health Clinics. I'm sure you're going to hear that acronym a lot today. But these things work, and Oklahoma is actually a national leader in the use of CCBHCs, and so if we can protect those and expand them, we can help prevent a lot of crises from happening in the first place. And for things that can't be prevented, that's where diversion comes in. It's effective, we know it works, but it's still somewhat limited. Diversion provides needed treatment for mental health and other physical health needs, services like education, job force training, housing, and reduces recidivism. We know this today. I believe that there's a diversion program here today that can speak a little bit more to that. And so one of the limits, yes?
I have a question for you. Is that okay, Chairman? Okay. The question I have is, I'm a criminal defense lawyer, and my concern as far as mental health, some clients are in custody and a person visits them, diversion program, and then they tell them that, hey, we have an appointment maybe 3 weeks later. No fault. I mean, they don't have the resources to do it immediately. As far as provide them care, what is that a concern of yours as far as making sure that they have wraparound services immediately once they get in custody, as opposed to an appointment, say 2-3 weeks out when they need the care immediately? Could you talk about that a little bit?
Absolutely. Thank you for the question. So that is a huge concern, and one that we do see in Oklahoma, especially because people stay in jail for so long. And one of the ways that we prevent that is providing diversion before jail even begins, diverting from jail before becomes a problem. And so part of that is our statute that only requires immediate diversion for persons requiring treatment. This is a statutory definition. Someone who is an immediate threat to themselves or others as determined by law enforcement officers, which these people are taken into protective custody. But I will say that leaves somewhat of a severity gap for individuals who have serious mental health needs that might not be immediately threatening but are still sent to jail that we know can exacerbate or cause further mental health issues. And so I think by expanding our diversion options before jail even becomes a choice, I think that is a big way to prevent that. And ensuring that once individuals get to jail, that we expand diversion services in our urban and especially our rural areas to ensure that those wait times are not as long. That also goes into expanding prevention and treatment, like ensuring that we have beds available in our facilities. And so if we
let me ask you a question real quick. And I agree with you on this mental health. I was in law enforcement for 40 years. Where do you see this money coming from? Is this the funding needed? Is it going to come from the state? Is it going to be private funding? What's your opinion? Where is this money coming from, and how much are we looking at?
So I think it's a great opportunity for private-public partnerships, a mix of money. Our 781 funds that come from savings from State Question 780 that are directed into 781, I believe we're at $12.5 million now, can be used by counties to invest in prevention and diversion services. So protecting and perhaps expanding that money as more savings come in, I think that's a very good way for public funds to be spent. I believe ODMH is here, and if their CCBHC platform, I believe it's going to be very effective, already has been. And so if there are requests for further funding for that, it's been shown that these diversion services, alternative courts, save public money. So if we take the money that we're saving and further invest it in these money-saving programs, I think that's a very good way to divert funds, state funds, county funds, municipal funds, into programs that we know work and further save money for the state. Absolutely. And so expanding these options will improve mental health outcomes in our communities, but also reduce the jail populations. And this is important that we prevent, and divert as many people from entering jail in the first place, because we know that once individuals enter jail, the risk for serious harm, mental illness, and suicide significantly rises. And a big part of that is because we have outdated standards regarding mental health for our jails, and people are kept in jail for an exceptionally long time. The most up-to-date research from Bureau of Justice Statistics shows that jail inmates experience serious psychological distress at double the rate of prisoners and 5 times the rate of the general population. Part of this is because incarceration in general is traumatic and can cause really negative impacts on mental health, things like loss of autonomy, fear, exposure to violence, the loss of routine and separation from loved ones. Yes?
The question I have as far as let's give you an example. An 18-year-old in a cell with, say, an 18-year-old person who's never been in trouble with the law, the first arrest, possession of marijuana, in a cell with a person who's 50 years old, who's a convicted murderer or child molester. What are your thoughts as far as them being in the same cell together? As far as their mental health.
I think that can impact a lot, especially if violence is present. It's not always present. I want to be clear about that. And also individuals who are in jail are largely being held pretrial, so they are legally innocent, but our jails in general don't have a lot of resources for expansive detention facilities so that you can't separate out like this. I know that we have security classifications specifically in Oklahoma County that help with some of this, but in general, when we send people to jail for a minor offense like simple possession, it exposes them to significant risk to their mental health. And for anyone who's in jail, in general, the environment is damaging to mental health. And so, yes.
Could you specifically talk about the environment of the Oklahoma County Jail and how that could affect an individual's mental health?
The facilities and environment structurally, no. But I do have statistics from the jail tracker that I'll get to a little bit later that goes into some of the population and some of the overcrowding concerns that we see in the Oklahoma County Detention Facility. And so, in general, another reason why jail inmates experience this serious psychological distress is because of our low jail standards and a lack of treatment and resources in our jails. So statutorily, the legislature sets broad standards for our jails that are then developed upon by the Department of Health and then inspected in every detention facility every year. But these standards on a statewide level have not been updated to match our current understanding of mental health in the criminal justice system. Our statute does not require that jails use evidence-based mental health screening upon intake. There is a requirement for jails to use and note the behavior of the mental health history of inmates, but none of these are required to be evidence-based. There are a number of survey types, provider types that are certified to do this, but we don't require those. And by not having these, we run the risk of missing people who need immediate help that might not have been caught by our law enforcement officers. We also don't require specific mental health training for jail staff. There are requirements for first aid training, CPR, jail rules, but none of this has been updated to specifically require mental health training, things that we've learned over the past few years as a world, scientifically, but also as a state on what works and what doesn't. And we also don't require immediate treatment for illnesses incurred before arrest. This includes mental illnesses that might not have been severe enough or immediately threatening to require a protective custody, but if they were incurred before arrest, the jail is not required to seek immediate treatment, so people have to apply for treatment, which can take a very long time and lead to some of the concerns that you had, Representative Lowe, about someone awaiting a competency hearing or awaiting treatment from a diversion program or a health provider because we have such a backlog of this. And so finally, jails lack resources and facilities that are required for prisons, and prisons normally have. Prisons are state funded, and so they have much more money and much more room to house not only inmates, but also services like education and recreation, which we know help with inmate mental health, that provide a sense of purpose, that provide a sense of autonomy over their bodies and their lives, that reduce a lot of the stress that comes with incarceration. And so a snapshot of the Oklahoma County Detention Center of this past Wednesday was taken by the OCDC jail tracker system. Oklahoma Policy Institute partners with the Jail Trust to track and publish and analyze this data on a weekly basis. This is the most up-to-date information, and it will be updated at noon today, so just after this hearing. But as of this past Wednesday, there were 1,520 people in the jail. When the jail was first built, I believe it was only intended to hold around 1,200 people. So this is over 100% of the intended capacity. It's been rated at about 3,000 people, maximum capacity by the fire department, but again, that's not how it was designed. That's not who it was designed to hold. And so of these 1,520 people, 4 in 5 of these individuals are being held pretrial. They have not been found guilty by a jury of their peers or have not pled guilty or no contest to a crime. 82% of this jail is being held pretrial, and often for a very significant amount of time. 2 in 5 of these individuals are Black, which is highly, highly disproportionate for Oklahoma County. Black residents only make up 16% of Oklahoma County, but make up 44% of the jail. This is about 5 times the rate of white residents. And so when we look at broader implications of lack of treatment, lack of access to social services. This connects to part of the disparities that we see in our jail population. And the average length of detention for these 1,500 people is 114 days. That's 3 going on 4 months of being stuck in jail. And yes.
Do you have any stats as far as how many people are in jail currently that are in there for violent offenses as opposed to nonviolent? There's a perception in society that everyone that's in jail are violent criminals. Are there any numbers that show addiction issues or mental health issues? Do you have any numbers?
For those 2 stats specifically, I don't believe we have that available on the jail tracker system, but we do track the charges that someone has either been booked on, or if they are being held post-conviction on behalf of the state, that they are being held on. I can get those to you later. I unfortunately don't have them with me today.
When you're giving him those stats, would you have any stats that show over the last 2 or 3 years, have you had a jail reduction or a jail increase over the last couple of years?
Absolutely. So that's actually my next slide. And so I'll go ahead and get to that. So in Oklahoma County, we've seen a significant decrease in our jail population. This tracks nationally, but I think is proof that a lot of the policies that we passed as a state and in Oklahoma County, like diversion, like prevention, help. They reduce this jail population. And we also have seen a slowing of the jail churn, the amount of people that go in and out, which leads to a lot of instability, costs the state and the counties lots of money, and has been shown to lead to a lot of violence. The jail churn is not a negative number, but I think it does prompt us to make sure that we're not arbitrarily holding people for extended periods of time. And if we go back...
Can I ask one question, stop
Yes.
you there, and I hate to interrupt you, but I'm very interested in this. So with that reduction, would you say that we need more services outside of the jail, outside of prison, community corrections type services in our community? Would you agree with that? If we're going to...
Absolutely. The reduction is very good, but we still have a far way to go as a state and as Oklahoma County. And so we see this jail churn slowing down, which means that the people who are in there are more stably in there, but the majority of people who were in jail as of the snapshot were in there for at least a month or more, which is a significant amount of time to be removed from your family, to be removed from your job, from the services, from mental health treatment that they might have already been receiving or might be awaiting to receive. And so this really gets to the fact that our pretrial release system in Oklahoma is broken. It keeps people in jail, especially people who are low income. Pretrial release options are often unavailable to individuals with low incomes, especially immediate release available via bond schedule. If someone can't cough up the $1,000, $2,000 that they are being charged in the schedule, they're stuck in jail until they are arraigned and then hopefully released on their own recognizance, but that's not necessarily always the case. And so that 82% being held pretrial is largely because they cannot afford to be let out of jail in the first place. And so we're keeping people in jail for 3-4 months at a time, and this prolongs the stressors of incarceration itself, the separation from family. We know this especially affects mothers. The sense of guilt and anxiety about being separated from children is especially hard on women with children in our jails. Loss of income. This not only affects the incarcerated person, but their family. They might be the sole provider for their family, and now they're out of money for a week, but also probably have lost their job because they haven't shown up for a month. Loss of autonomy, fear, exposure to violence, all of which contribute to worsening mental health and long-lasting traumatic experiences that carry over for the rest of people's lives. This perpetuates the cycle that we've been seeing and we know that exists. And so breaking the cycle, getting people out of jail as soon as possible, as long as they're not a public safety risk or a flight risk, ensures that we don't perpetuate cycles of trauma and loss of income and criminality. And we can divert them to diversion services that we know reduce recidivism, help get people back on their feet and into a stable, productive life that helps our state and our communities overall. So as a state, we really need to continue expanding upon the successes we've seen in prevention and diversion services. Rep. Humphrey, I believe you weren't here when Rep. Hardin asked this question, but our 781 funds and the funding for that, we already provide funding to counties for this, ensuring that that's protected and perhaps even expanded as we continue to calculate the savings from State Question 780, ensuring that our counties can actually provide these services that we know work. We need to modernize our training and quality and availability of mental health treatment in jails, ensuring that our jail staff are equipped to identify the current symptoms and the precursors of mental health crises so that we don't have people dying unnecessarily, or any dying isn't necessary, but dying in our jails because of mental illness.
You would agree that it's a statewide issue and not only an Oklahoma City issue?
Oh, absolutely. And I believe we have several speakers today who are going to touch specifically on rural Oklahoma. And unfortunately, I don't have the data available with me, but this is a problem that we're seeing in those areas, especially because of lack of access. Oklahoma County is has some of the most accessible mental health in the state, and we are still seeing a lot of these problems. So for rural areas, for poor individuals, for Black individuals, for youth, this lack of services is especially low. And we need to finally develop effective and equitable pretrial release systems to ensure that we're not keeping people in jail arbitrarily just because they're poor. If we can help get people back on their feet, help get them treatment that they need early on, we're not going to continue to perpetuate cycles of trauma, that we can ensure that people get the treatment that they need so that this doesn't happen again, so crises don't occur in the future. So with that, I am open to questions, and thank you.
I think you answered all my questions.
Awesome, thank you.
In my 40 years in law, when I first started in law enforcement, unless you were a career criminal, people who had mental issues hardly ever went to jail. We had resources back then where I remember back Oklahoma County Sheriff's Department. Actually, we had a contract with them, Oklahoma City PD did, that if we came across someone with mental issues, the contract was that Oklahoma County would come out, the deputy would take care of that issue and find a place to house them other than a jail. And I know that when I was sheriff in Adair County, it was an issue of mine that I had with the judges. There's nowhere to put them, so we're going to put them in jail. So I guess my question is, we need to turn this around and get them back into mental health somewhere besides a jail. Do you agree?
Absolutely. And we've seen statistics of the number or availability of beds per capita significantly dropping, and as that drops, our jail populations rise. This is national and statewide as well. So absolutely, expanding bed access, I think, is one of the most impactful things that we can do as a state. So ensuring that CCBHCs are protected and funded and expanded, especially in rural areas like Adair County, will ensure that we don't have that problem. We have somewhere to put people instead of jail where we know that they can get the treatment that they need.
And I may have missed and I apologize to everybody. I was doing a press release on doing a grand jury on child abuse. And so my question, I didn't see anything, and I may have just been late, but did you talk about how many of your inmates in Oklahoma County Jail are mental health?
No, I don't currently have that data. We are working with Jail Tracker System to hopefully get that. But part of the lack of data comes from a low standard on our jail intake forms themselves. We don't require evidence-based intake formulations that can catch those symptoms and can catch those individuals, not only so that we can divert them to treatment, but just so that we can know as a community how much are we spending on keeping people in jail who aren't going to get better.
Would you agree, coming off what Representative Hardin was asking, would you agree that due to the fact that we see less or appears to be less services in our community, that many of the people that have mental health issues end up in jail and end up going to prison because they are mentally ill and then our prisons and jails are not equipped to deal with them, so they get absolutely no service, and they cause the jails and the prison massive disruption. And that if we would look at having mental health facilities like we used to, what he was talking about, that it would solve these problems.
Absolutely. You said it better than I did. And I believe some of our diversion services and ODMH can talk a lot more about that. But yes, putting people in jail and prison just because they have mental illness isn't right, and it's only perpetuating cycles of trauma and also costing the state more money in the end.